Hello, my name is Emily Bodwin. I'm a neuromuscular massage therapist and restorative exercise specialist. This last week, I woke up with my masseter muscle, which is this muscle right here, really aching and clenching down. And later that afternoon, I had a bunch of swelling happen in my entire cheek area. Come to find out, it seems to be that the saliva gland in this area got clogged up, and I actually had to go on an antibiotic. But I was having the masseter muscle, my temporalis muscle, and the medial pterygoid on the back of the, let me see here, sorry. The medial pterygoid on the back of the jaw, just tightening down and clenching and causing also ear pain. So I started working on myself because I'm a TMJ specialist. So I'm going to give you another method of massaging this masseter muscle here. And I'm wearing my gloves because you want to do that. You want to be laying down, not flat, but slightly elevated. So I'm elevated on top of a folded over blanket a few times here. And I'm going to take my thumb. My thumb's going to go inside my mouth, and it's going to be working on the inside. I'm going to be using my fingers to pull across. And I'm going to start in the midline, the center of the muscle, and then work towards either side. Underneath this cheekbone here, the zygomatic arch, it's actually going to be the most sore. I do need to be careful though, because I have had jaw surgery in the past where they moved my top jaw forward and I still have screws in there. So I can't work on that area where the screws are directly. As long as you haven't had that surgery done and have the hardware there still, you can work quite extensively underneath that cheekbone zygomatic arch. So let's begin. So for me, I was finding that, yes, the midline, the center of the muscle was sore, but it was most sore right here on the edge and right here up on the edge up here. So if we take a look at our TMJ skull again. So I was most sore right down here and right up here. And that's in alignment with the muscles being really tight. So that is something I recommend doing while you're laying down. You can do this when it hurts, absolutely, and it can help calm things down, but practice doing it when you're not hurting so much. You're more likely to have longer term benefits from adding this into your jaw routine. Doing it before you get out of bed in the morning or right before you fall asleep at night. Definitely with some gloves on because it allows you to glide. And definitely laying down because the saliva will build up and it will be harder to massage if you're sitting up doing this. You can still do it, just have a tissue or a towel around to mop up if you need it. I hope that this was helpful, and I'll talk to you later.